And so my point was, we do not want child protection to be our entryway into services for people with disabilities. And so we really need to pay attention. It's important that legislators hear this information, that they know that this is really happening already, and what kind of crises are further cuts going to cost. Because the bottom line is, when people hear we need these supports, they think those supports are going to cost money we might not have. But the follow-up to that story is, without these supports, you're going to create crises which are considerably more expensive. So we need to make sure that people know in detail what kind of supports we get, what will happen without the supports, and if you're not getting supports, what's happening to your family or your family member because they don't have the supports available. We also want to talk about expenses. Those of you who have children under 18, if you get medical assistance and you are not middle income or above, you may be paying for the TEFRA program for medical assistance, which requires families to pay a parental fee. A lot of legislators may not realize that even though you're paying a parental fee for your child to have that medical assistance, that medical assistance is only for your child with a disability, and it is only over and above what you may be paying for other health care premiums or other health insurance that your family has. So you need to talk about, when we're talking about increasing parental fees, if that applies to you, you need to talk about what is that expense already doing to your budget, and what expenses do you have for your child with special needs? What are you covering as a family already that's over and above what a typical family might need? And those of you who have more than one child, sometimes that's a little bit easier to do. In my case, I have 3 kids, so I was able to say, David needs this, his siblings need that, and a very disproportionate amount of our family resources, whether it's our time, our personal resources, our energy, our finances, a disproportionate amount goes towards my son with a disability compared to his 2 siblings who don't have disabilities. Now, I told you to include all of these things, and then I'm going to say, keep your story short. 1 page is if possible. And so that's one reason that it's helpful to look at other examples of stories, to kind of practice, to have it written, so you really have it pared down to what are the key things I want to express. And if you print your story, include a photo of your family member or your entire family, so that people can put a face on the issue. People remember faces more than they remember written words. The other thing is, I bring my son to the Capitol with me sometimes, and then people recognize him from the story that I've shared when he's not with me. You also may want to provide a fact sheet listing your public policy priorities, or an organization you belong to using their fact sheets, and you can just staple them to your story so that you don't have to have all the facts and all the data. You can use printed materials, and almost all organizations have them, to enhance your story or to hand out to your legislator if you're doing a one-on-one visit. Then you want to use your story for a variety of purposes. And I've touched on this already. If you have your story ready, then you can modify it very easily to highlight particular issues. Or you can provide it as a supplement. I walk around with a dozen or so copies of my story every time I come here. And if I meet someone in the hall and I'm with my son and they stop to greet him, I whip out his story and hand it to them. If I testify on an issue, very often you're given 2 or 3 minutes to testify. So I often will hand out my story so they can get all of the data, all of the information that I want. And then in my speaking points, I just touch on the issues or the item that I'm there to testify about, but they have the full background of my information by seeing that whole story. You can prepare talking points, like I said, so that you can speak from your story and then your story will supplement. A lot of places neighborhoods have a time when the legislators gather, particularly off session. That's a good time when legislators aren't in session, that they might be having town hall or neighborhood meetings, and you can share your story ahead of time. So this isn't something that we just do during the session. I usually prepare my story in late summer, early fall, and then I modify it all session depending on what comes up. Then if you've met with your legislators and used your story at a town hall forum or at a time when you're not really asking for anything, then they'll remember you when you go back and you are asking for their support for an issue. Again, I talked earlier about how you can use that story to respond to action alerts or other issues by cutting and pasting. I have a few key sentences that summarize our family situation, and I cut and paste those all the time into letters to the editor, or maybe you're asked to write an article for an organization you belong to. You can use that story as a base for other things. And then you can provide copies of your story for friends and relatives to share. Sometimes people will come to things like this and say, well, it's not really my story, you know, it's my nephew, or it's my neighbor, or I work in the field, but I don't particularly have a story. Everybody has a story. With the current rates and the studies on autism and the prevalence, everybody knows a family who's been affected by autism. And so their story might be how they see your family from a neighbor's point of view. Their story might be just that I support the struggles of this family and I want my tax dollars to go to programs that support individuals who need help. So a lot of times you can get people to respond and you give them the information so it's really easy for them. You formulated something. Lots of social networking going on today. I post my son's story on my Facebook page. And every time I testify or if I'm at a press conference and there's any coverage, I put that little link out there so that people can see this is what's happening right now and we need your help. Because the truth is we don't just need our policymakers to understand, we need our community to understand why our children need these services. We want taxpayers to know you're getting good bang for your buck when we use tax dollars to support families in raising their individuals with autism. And we're getting good bang for our buck when we put our tax dollars towards autism therapies that help move a child from needing a lot of service and a lot of individual assistance to potentially living as independent adults. So we need to make sure that once we've written our story, we get it out there wherever and whenever we can. And then after you've shared your story, whether you've emailed it, mailed it by mail, spoken to someone over the phone, met with your legislator in person, follow up your contact with a thank you note. And again, I do this even if I've met someone in the hall who stops to greet my son and I've thrust my story on them, and then I follow up and say, thank you for stopping to talk with me today. And then the reason I do that is not just because it's polite, it also gives you an additional contact with that person. And so whether or not they're in my district, if they've met my son and seen my son when I've testified, then I follow up. And I follow up not just to say thank you for stopping to talk, but then when a vote comes up, I can do a reminder call or an email that says, remember I met with you last week, or we saw you in the hallway, or you attended this town hall meeting and I was there, and I want to remind you that this information or this issue is up for a vote this week. So please come and talk to me if you need more information. Remember my story. Share my story. My particular legislators in the area where I live tend to be in favor of the supports for individuals with disabilities, and so people sometimes say to me, well, you know, I'm kind of preaching with the choir because I think my legislator gets it or they're going to vote my way. But you know what? Sometimes legislators who are in the minority need our story so that they can say, I had this many constituent letters or contacts on this issue. Or here's an example of something that happened to one of my constituents. Now my legislator can tell that story about my nephew who had the crisis and then has child protection involved with their family, because my legislator knows that story, knows it's a real story, and can share it when talking about the devastation that could occur if we cut all the support services that our individuals need. If you can also follow up with the agency that's asking you to write their stories, often they speak on your behalf, whether it's to legislators or whether it's at events like this. They need to know that you've written your story and contacted your legislator and that you're prepared to speak to the issue, so that when they're having a forum like this or any other kind of event, they always need speakers, and you guys don't want to see the same faces trotting up all the time. So if you want to get invited, let people know that you have a compelling story to tell and that you're willing to share it. And if you need more information, again, there's some information specific to telling your story at our booth. There's a handout, but many, many organizations can help you with this. We just need to know that you're willing to speak up, to write your letter, to write your story, and ask us for help, and we will be there. I am not a paid staff. I'm a volunteer, and I probably spend about 40 hours a week either here at the Capitol doing workshops like this on telling your story, meeting with my own legislators, or at home on the computer emailing story drafts back and forth, where I'll help people, I'll read it over, I'll make suggestions, always keeping it in an individual's own words, but talking about how to make it as effective as it can be, or in some cases, cut it from 5 pages maybe to that 1 page that, that we want it to be. Now, I can talk about this forever and ever and ever, but I'd really like to be effective in terms of, are there people who have questions? Are there people who have examples of sharing their story and the particular outcome? As I said, I'm not the expert. The experts are here in this room. It's all of us. You know your story. Other organizations, other people may have facts and figures and information, detailed information about programs that you don't have, but you are the expert on your individual or family story, and you have information that others need to hear.